If you're a nursing student and you suck at math, raise your hand because you're not alone. I sucked at math too. And I never knew that I would encounter so much calculations when I entered into nursing school until I met dosage calculations. So hey, and welcome to another YouTube video. My name is Dr. Nurse Vicky, and today we are going to break down some of these dosage calculations. Now here is my thing and my philosophy. If you don't understand the basics, the advanced stuff gets super complicated. So today I want to break down some of the basic dosage calculations that you need to know at your fingertips so that when we go to the advanced stuff, you get it. So let's go through some of the topics that we'll be going over today. The first one is IV flow rate, IV drop rate, tablet dosage, weight-based dosage, liquid solutions, time left in your IV bag, and dosage conversions. I will be starting by giving you the formula, then we go over a scenario, and then we will calculate it together. Let's get started. Now, if you're looking for any of our nursing school study guides that also include dosage calculations, head over to the link in the description. I have our nursing mega bundle that includes all of your nursing school topics. So click that link and grab it. It's currently on sale. All right, grab your pen and paper and let's start calculating. We are going to start with the IV flow rate, and your answer will be ml per hour. Okay, so here is your formula. Total volume over time in hours. We're not changing anything to minutes because we want the flow rate ml every hour. So the total volume over time in hours. So here is our scenario for today. Here is your order. 1,000 ml of normal saline to infuse over 8 hours. So you have 1,000 ml of normal saline, you want to give it over 8 hours. How many ml will be running per hour? Very simple. Take the ml, that is your total volume, over the number of hours, and that is 8 hours. So I have here 1,000 over 8, and that will give you, that's correct, 125 ml per hour. So that's it for IV flow rate. Very simple, very straight to the point. Don't get confused. Number 2 is IV drop rate. This is how much drops you want per minute. So let's go. Here is your formula. Volume over time in minutes. See here, there will be a bit of conversion if your question is asking you in hours, times your drop factor. I'll say that again. Volume over time in minutes times your drop factor. Let's get the question. You have to give 500 ml over 4 hours with a drop factor of 15. Let's get the volume. The volume is how much? 500 ml, correct. Over time in minutes. Now you have time in hours. So we will put there 4 times what? 60. We want the minutes. Times the drop factor, which is 15. So here we have 500 over 240, I did the calculation for you, times 15. This is going to give us 31. All right. Let's go to tablet. That is tablet dosage. Here is your formula. Dose desired over dose on hand. This will give you the number of tablets. Now, what is the dose desired? This is what the doctor is going to prescribe. Dose on hand is the tablet that you have in hand. What is the dose? So here is your scenario. The doctor orders 650 mg, that is milligram, of a medication, so medication X. Tablets are 325 milligrams each. What is the dose desired? That is what the doctor orders, 650. And what do you have on hand? What is on your tablet? 325. Let's do that division. It's going to give you, correct, 2 tablets. Next, weight-based dosage. In this case, we need the patient's weight to be able to give the patient the correct dosage. So this is your formula. Weight times dose per kg. Again, weight times dose per kg. Let's get the scenario. Here is your order. 5 milligrams per kg of a drug. 5 milligrams per kg of a drug. And the patient's weight is 20 kg. That's kilograms. So what are you going to do? Weight times dose. Patient is 20 times 5. That is going to give you 100 milligrams. Next, liquid solution. Now this is when you have to give your patient maybe a syrup. That is your liquid solution. So let's go. It's similar to the dosage, that is the tablet dose, okay? But now you have volume included. So this is your formula. Desired dose over dose on hand times volume. Again, desired dose over dose on hand times volume. So this is your order. 75 mg. And what is available? What do you have on hand? 100 mg in 5 ml. So let's put that all together. Let's calculate. And you got 3.75 ml. Let's go to time left in IV bag. So here is your scenario. You have 1,000 ml bag that started at 6 a.m. at 125 ml per hour. It's now 9 a.m. It's now 9 a.m. How much is left? This is a two-step process. So let's go. The first step shows that 3 hours have elapsed. Okay, so you started at 6 a.m. and now it's 9. So when you do that calculation, you realize that 3 hours have gone by. You already know how much it's running per hour because it told you that it's running at 125 ml per hour. Now what will we do? We will times how much it's going per hour by 3 because 3 hours have passed. And this is going to give us 375 ml infused. So what is left in the bag? We will now subtract the 375 from the 1,000 ml to tell us how much is left in our IV bag. Lastly is dosage conversion. Why is this important? Because sometimes you are going to get questions in different units and you need to know how to convert it. So let's do this scenario, okay? So the doctor orders 0.5 mg of a drug. The vial labels says 250 mcg per ml. It's not mg, it's not milligram, okay? How many ml should be given? So here, you're still going to use the formula, but you first need to be able to convert. And you're converting 0.5 mg to mcg. Let's do this. Step 1. We are going to do the conversion. So it says 0.5 mg is the same as 500 mcg. Okay, that's step 1. Now we know that. Now we are going to plot it because we have the volume here as well. So it's going to tell us 500, okay, over 250. Now we have the same units at the top and the bottom times 1 because it's every ml. Okay, so if you don't see any number in front of the ml, it means 1. That would give us what? 2 ml. And that's it. So now we went through some of the basics in dosage calculations: IV flow rate, IV drop rate, tablet dosage, weight-based dosage, liquid solutions, time left in bag, and dosage conversions. But I don't want you to stop here. I want you to practice, because when it starts to get complicated, at least you know the basics so you can step it up. All right, thank you so much for being here, and I cannot wait to see you in our next video. Take care.